Today on the Ortho Perspective, we're joined by Andrew Blexrud. Andrew is the creator of Orthoboost, which is an automated system designed to help orthopedic practices attract new total joint patients. Welcome, Andrew.
Hey, Stu.
Yeah. So, Andrew, from your experience, where do you see orthopedic surgeons and their groups making mistakes when they're trying to attract new patients to their practice?
I would say the biggest thing is the discrepancy between a website and a sales funnel. I always call it a sales funnel, but I should really call it a patient funnel. When you're running your ads, say a Google ad, somebody clicks the ad. The first place they're typically sent to is the practice website, whether it's the homepage or the bio of a specific surgeon. The problem with that is you're giving them so many opportunities to get distracted. And, there's a metric out there that it's like something like 60% of people that visit your website never come back. If you are a practice owner and you have access to your website analytics, you can see that your customer return rate is probably super low. And so the biggest mistake is sending them to your website, not having a proper patient funnel in place. For us, what we create is a simple one-page website where, say you want more knee patients, the ad is completely tailored to attracting joint replacement candidates. And the ad copy on the website or on the patient funnel is 100% tailored toward attracting those knee patients. And there are no external links. The only thing that somebody can click is a big orange button that says book a consultation.
Yeah, so it's a very focused, go to this web page, they go there. Basically, their only option is to make an appointment with the doctor and not get sidetracked. And even something that you said triggered in me something that I've heard many times. The author Donald Miller's, who I give it credit to, is it takes telling something or telling a story 7 times for someone to start understanding what you're saying, which would give credence to go to a website and you never go back because either you forget to go there, whereas if it's totally focused on one thing, that makes sense to me. As we talked before we started recording here, you only work with private practice physicians, correct?
Correct.
And you work with individual doctors within private practice groups. And what do you do? I'm just thinking of a question surgeons may have. What do you do if, I'm Dr. Brandon and there's Dr. Smith, just a few miles down the road from me?
In terms of
just how do you handle that? I mean, are you willing to take both of us on, create competition?
No, because then I'd be competing with myself too. I'd be running ads trying to, you've got a certain audience size with your ads. So really I try to stay as like 50 miles away,
Gotcha.
One surgeon per city is how we do it, or one practice, I should say. And then when we run the ads, we run the ad for the surgeon, not the practice. The only time the practice is mentioned is, the first sentence in the ad copy in the sales funnel. There's the logo of the practice on the header of the sales funnel, and that's it.
Gotcha.
When we work with a practice that has a lot of, multiple surgeons that want to run the same campaign, we got to do it one at a time. So if it was like a really big city, we could run 2 at the same time, but that's just not how I do it, or not how I have done it. Right. So it's really about filling one surgeon's calendar at a time in that case. So,
which that makes sense. So from your perspective, why are surgeons hesitant to advertise in general and then maybe even use your services?
Sure. I think within the orthopedic space, Google Ads has just been what everyone's done forever. If they're running ads, it's on Google. They'll try it on Facebook and then it doesn't work because they're trying to use the same method they use on Google. And then again, they're sending them to the practice website. It's super distracting for us. Here's the other thing. When you're running an ad on Google, you're like, one of the first four things that pop up. The first four things you see on the first page when you type in orthopedic surgeon, Dallas, Texas, you get like 3 or 4 ads, and then you get like 3 or 4, whatever you call it, 4 different surgeons' names with their reviews under it.
Right.
So you're in competition on that page with all these different people. People are just, it's no offense to anyone who's doing it. It is effective. But, if I'm the one that has a bad knee and I go to Google and I'm seeing that page for the first time, there's so many different names, so many different reviews. So I'm clicking those ads, and which are all going to these practice websites, and I'm just all over the place. I'm not really focused on what I'm supposed to be doing, or I'm getting really overwhelmed. So what we do is we run a Facebook ad to the patient funnel. And what that does is it catches people who are ideal joint replacement candidates. They know they need help, but they're not actively looking on Google where you and all of your competitors are sandwiched together. The other goal is to help them to get to know, like, and trust you, get them to feel understood, that you can help them get back to normal, because ultimately that's what they want.
Right. Well, you mentioned know, like, and trust, which this we didn't talk about before we hit record, but this is actually the reason why I reached out to you originally. Was you had a short video on LinkedIn giving away a free tip on, I believe it was encouraging surgeons to shoot a simple video. You remember that post you did?
Yep.
Can you just give away that free tip for them right now as to one simple thing that they can do today?
Yeah. Here's the thing. If you look at all of my LinkedIn posts, what I'm trying to do is just give everything I know away. If you were to read every single post in the last 6 months, what you could literally do is create your own campaign, start generating leads, especially when I talk about retargeting. That's something you could do within a couple hours. I can do it in like 20 minutes, but it's because I've clicked all the buttons a million times to get it set up. But that's one thing you could do to start attracting patients right away. And forgot your question.
Well, the question was, you did a quick video suggesting surgeons make a video. And what was the premise of the video?
Yeah, so for every new client that we sign on, we have them make a 1-minute video. It's called, the topic is what to expect during your initial consultation. So you're sitting in an exam room, and you're simply talking about what to expect during your initial consultation. And we give surgeons free reign. I mean, talk about it however you want. Just try to keep it to a minute, because people just don't have a very big attention span. We've found if you go to 2 minutes, it does not perform as well. We've spent a lot of money trying to figure this out over the past 4 or 5 years. So you take the ad. I don't recommend boosting posts, but you could kind of test it out that way. You take the ad and then go through my other posts where I talk about how to write the ad copy. I've got the frameworks for it. You plug that in, run a Facebook ad. You can create your own sales funnel. You can create your own sales funnel with ClickFunnels, lead pages, go high level. Like, there's so many softwares out there. You could literally just pick a template, plug in the other information I wrote in the other post about what to put in the sales funnel, and start attracting new leads, tomorrow.
Yeah. Well, I appreciate you suggesting and telling them that. And that's one of the things that attracted me to want to reach out to you, is the fact that you were giving away ideas for free. And that's something that I feel very strongly about. So if there's any orthopedic surgeon or their practice out there that wants to get in touch with Andrew, what is the best way to do that?
The best way would be to either message me on LinkedIn at Andrew Blexrud, and the other option would be orthoboost.co, not .com. You can fill out a really simple form there. I just ask you a few questions. It takes about 2 minutes. Just helps me to get a better understanding of your practice, what your goals are, what your needs are. And then we jump on a quick call and we just go from there.
Perfect. Well, Andrew, I appreciate the time, and I hope you have a great rest of your day.
All right. Thanks, Stu.
Thanks.